Hello, I'm Mike Poore, Superintendent of the Little Rock Public School System. I'm so excited to get to talk to you today and talk a little bit about the transition that you're about ready to experience. We know that all of you right now that are receiving this message are leaving the pre-K environment and headed towards our kindergarten. Transitions are tough on children, but a lot of times they're hard on families and on parents. We want to do everything we can as a school family to assist you with that transition and make it as comfortable for you as possible. Probably one of the most basic and fundamental things that we can advocate for you to help us with and to support us is to have your child get a wellness visit at your hospital or with your doctor. This wellness visit is like a physical, at least back in my day, what we called, of having a check on your student so that they're all looked over and checked for all the wellness indicators. This is critical because if you look at research, we know that if a child misses more than 10 days, it ends up causing that child not to have the ability to really get a year's worth of growth academically. 10 days does not take that much, and so wellness is really critical. The wellness visit with your physician will bring a lot of other things. One of the best things that physicians can do and nurses can do is offer you thoughts about prevention. That's critical because if we're proactive in our approach with health, we can prevent major illnesses or different types of disease. A second thing is that we can also track development of youth, and that's a critical thing because if you track the development, you can make sure that your child is growing in a healthy way. So that's an important factor with these wellness visits. It also gives you an opportunity to have a relationship with that physician or with that nurse to raise concerns that you might have, and that's a part of their job, is to address the concerns or issues that you may be having within your child. Last, it starts to provide a team approach. And that's something I'm also excited about because the team approach is you as a family, your physician, but then also the staff that you will encounter at the kindergarten level. It's not only the principal and the teacher, but it's our school nurses who make a difference for each of the children that we get to serve. And we're anxious to serve your child. So please, right now, make sure you go set up a wellness visit today if you haven't already done so. Don't delay, don't wait. Do it today, get it off your list. It'll make things a whole lot easier taking that proactive approach than waiting right till school starts, because that's when stress starts to pick up. You don't want that as your child makes that transition. Get to a doctor, do your wellness visit, and we can't wait to have your child in our kindergarten to start off the 2019 school year.